Hi, I'm Gretchen Claude from High Country Physical Therapy. I'm a pelvic floor physical therapist, and today I'm going to be talking a little bit about some pelvic myths that I see quite a bit in my practice. But before I start, make sure to subscribe to our channel so you can get up-to-date physical therapy information and free tips and tricks. Number 1, it's okay to leak urine when you exercise. Leaking urine is oftentimes a sign that there's a problem with your abdominal pressure management. Who would ever think it's okay to have a disc bulge every time you jump? There's lots of reasons why you might leak urine while you exercise. Maybe it's because your pelvic floor force is a little too low. Maybe it's because your pelvic floor is too tight. Or maybe it's just because there's poor coordination between the muscles of your abdominal wall. Regardless, leaking urine while exercising is never okay. Number 2, it's normal that intercourse is painful. Intimacy and intercourse are really complex topics, so it's silly to think that we can solve these problems with one solution. Pelvic floor function may be one of the solutions to your problem. Number 3, Kegels are the solution for all leaking urine. Oftentimes, leaking of urine may be caused by a hypertonic or too tight of a pelvic floor. When you do a Kegel contraction, you're tightening and strengthening those muscles, so you may actually be making the problem worse. Number 4, no one should ever plank, squat, run, jump, insert your own exercise here, after having a baby. After having a baby, oftentimes women may feel a little bit fearful of returning back to exercise, and it's no wonder why. With so much information on the internet available, it's hard to know what to do and what not to do. A trained professional can help to determine when and what sort of activities will be best and most appropriate for women after having a baby. Number 5, a diastasis recti can only be fixed by surgery. Irregardless of the time since the injury, oftentimes a diastasis can be significantly improved with appropriate manual therapies and exercises to help treat the diastasis. Simply doing crunches or sit-ups or even doing planks can actually be harmful for the diastasis. A trained professional can best help to guide you in your return to recovery. Myth number 6, your lifestyle does not affect your pelvic floor. Diet, exercise, stress management, and mental health all play contributing factors in the health of your pelvic floor. A systematic and holistic approach to the pelvic floor is oftentimes the best sustainable solution for the pelvic floor. So there you have it. There's 6 myths about the pelvic floor that I oftentimes hear in my clinic. If you have other myths that you hear or you want me to discuss, please comment below. Make sure to subscribe to our channel because we're awesome!